but this first one that you have joined us for is a new telehealth, telemedicine program that we're very excited about making available to our members. And not only are we excited because of the features and benefits of it, but there's also a way for some folks to get it partially for free. So, which is always a great thing. Jeff Roberts from Capstone is going to be sharing with you today, and that's whose screen you're seeing right now. And we met about 6 months ago and started chatting about their program. We were very impressed with how well developed it was, and I think it has a lot to offer all of us. So I'm going to turn it over to Jeff. I'm going to turn my screen off so I'm not a distraction, but I'm still here in the background. And Jeff, I'm going to let you take it away.
Thank you so much, Brett. I really appreciate all the support from the Chamber and your concern that you've expressed to me a number of times for your employers, especially during the times that we're all living through with COVID. So my name is Jeff Roberts. I'm one of the founders of a national healthcare company by the name of Capstone Health Network, which I formed with 7 physicians. We're going to try to accomplish a lot in a very short period of time. And because these type of events by nature have to be generic, if you are intrigued by what you're hearing, please feel free to reach out to me. We can have a custom discussion, which is going to be all about your company or your organization and your needs and how we could benefit you. But broadly speaking, we want to talk about 3 different areas where we might be able to be of assistance that are plaguing so many of the employers around the United States. First, how can we protect our employees from catching and spreading COVID-19? And this is really important because in addition to watching over your employees' health, if some of your employees come down with the coronavirus, it's very possible that your business could be forced to pause or even shut down. And one of the elements, as Brett was alluding to, that's merely one portion of our program is telemedicine, which the CDC, Anthony Fauci, and American Medical Association and others are heavily recommending as a way to stop people from catching and spreading the coronavirus. The second one is that healthcare in America, with the exception of the upcoming political debate in terms of next presidency, healthcare has been for years the #1 issue in the United States. The challenge is healthcare we all know this, costs too much. So how can our companies find affordable healthcare options for our employees? And then third, if this was more regular times, how can we find quality employees and also reduce employee turnover, which is especially problematic in smaller employers? And then if you like what you hear, the Chamber has negotiated with Capstone Health Network to be able to provide members of the Chamber 1 month of free health care for your employees. And it doesn't matter if you have 1 employee or 1,000 employees. We'll explain in a minute how you can get 1 month of free health care. So a couple quick housekeeping issues. As Brett referred to before, we might want to have everybody put their phone on mute. Hold any questions to the end, if you will, because they may well be answered as we're doing the presentation. And as I just mentioned, this session is generic, so we would love to have a complimentary one-on-one discussion about your business. And the last slide is a way that you can contact me. So we're going to try to accomplish a lot. I'm going to tell you briefly about our company, Capstone Health Network. We're going to talk to you about our unique healthcare program, which is called Capstone Care, which is a very high quality but low cost alternative to traditionally high cost and high deductible healthcare. Our program works whether or not you don't have health insurance that you offer currently, or it can be a supplement to the high cost, high deductible healthcare that you currently are providing. And again, it works whether you have 1 employee or 1,000 employees. So let's talk very briefly. We talked a little bit that the Center of Disease Control, the CDC, is strongly recommending telemedicine, telehealth as a way to minimize catching and spreading the coronavirus. One of the things that's not being reported on all that much because of all the other challenges with COVID-19 is that many people are afraid to go ahead and get treated at a doctor's office, an urgent care, or an ER. So they are not getting care for things that that they should be treated for, and that's a really big problem. But one of the things that telemedicine does so extremely well, it allows people to be treated from the comfort and safety of their own home 24 hours a day, every day of the year. And in our case, the way we do telemedicine, and we'll talk about this in a moment, there are no doctor bills, there are no copays, and there are no deductibles. So we are a social good national healthcare company, and that explains one of the reasons why our pricing is so low. For us, it's not just about how much money we can make like a traditional health insurance company would, which we are not, but it's how can we help people. So our goal was to make healthcare faster, easier, more convenient, and more affordable. Now, I've been a small business owner for decades, and I know how frustrating it is to want to be able to provide health insurance but not be able to afford it. And realistically, there are just very few options. This is a truth that we probably all don't want to hear, but I owe it to you to tell you this. We work with a lot of chambers, such as the wonderful chamber that you belong to, and one of the number one issues that we hear from chambers of commerce in terms of their members is, how do we find affordable health care? And the truth is, there isn't any out there. Health insurance would typically start at anywhere from a couple hundred to a couple $1,000s a month. And if one is a small company, in many cases that just doesn't work with companies' budgets. But the challenge is there are a lot of hidden costs to not providing health insurance, which I know that you know all too well. It puts small employers or employers of any size at a competitive disadvantage. It causes problems with hiring quality employees. It tends to lead to high employee turnover because there's nothing to particularly anchor that employee to a particular job without a benefit like health care. It also leads to unnecessarily large numbers of sick days and call-offs, and these are just a few of the problems. The expense of hiring and then retraining and then having to go through the process again when people turn over. So we created something called Capstone Care. Now, it is not health insurance. It's an alternative to very high-cost, high-deductible health insurance. We cover basically 75 to 80% of what health care does, but we do it at 5 to 10% of the cost. So briefly, we're going to talk about our program, and then we'll talk about some of the benefits to you and other employers, because they're quite real. So we have two programs. They're both called Capstone Care. We have an entry-level program, a basic program, if you will. It's called Capstone Care Silver. And we'll start with that one. But both of our programs include 24/7, 365-day-a-year telemedicine. Again, there are no doctor bills, there are no copays, and there are no deductibles of any kind. Telemedicine does not treat things like hospital stays, cancer treatments, etc. And that's one of the things that drives up the cost of healthcare and makes it unaffordable. Because let's say, for example, I have a very dear friend that's on a waiting list to get a new heart. He's got severe heart disease. Well, that may only be 1 out of 10,000 people, but we're all paying for that because the insurance company has to factor that in terms of what they charge. Or those that need expensive treatments or a month in a hospital or something. The vast majority of reasons that we all tend to see doctors have nothing to do with that. But traditional health insurance forces us to overpay for things that we're really not going to ever need. So it's like asking someone to pay for a Rolls Royce when basically they need basic transportation, which is what we're offering here. So the first element of our program is telemedicine, which the CDC and American Medical Association and others say is an ideal way to treat the top 75 to 80% of the reasons that we all tend to see doctors. If you think about your own families, the kind of things that telemedicine is ideal for would be, gee, someone has a flu, they've got a fever, they've got a cold, they've got a child with a skin rash, maybe they're nauseous, they have a child with pink eye, or somebody in the family has an earache. I used it for a sinus infection that I had on a Saturday, and I was able to talk to a doctor here in Ohio in under 10 minutes. Everything is Hipaa compliant. The doctors are all U.S. based. By law, they have to be licensed in the state in which you, the patient, resides. So in this case, it would be California. The average time to talk to the doctor is under 30 minutes. We say under an hour, but the actual average is 26 minutes. The doctors are able, where it's appropriate, to prescribe non-narcotic medications, and they can be sent to the pharmacy of your choice. Again, everything is Hipaa compliant. There's electronic health records. The consultations with the physicians can be by phone, they can be by video devices, whatever is most comfortable. And the services, which is important in a state like California, the services are available in English and Spanish. We also include something that's very important in the high-stress times that we're living right now, which is short-term, no-charge mental health counseling. Now, this is not unlimited like the telemedicine program, but like telemedicine, there are no counselor fees, there are no deductibles and no copays. It's the kind of thing that would be ideal for your employees to get care for depression, stress, anxiety, losses, relationship issues. Maybe they're panicked about COVID, etc. Counseling is done by master's level counselors. They do have experience with substance abuse. And again, telemedicine and mental health counseling is available in both English and in Spanish. We also include discounts on all FDA-approved prescription drugs that can be redeemed at 64,000 pharmacies nationwide. All the main pharmacies, the Costco's, the Walgreens, the Rite Aids, etc., are participating, plus thousands of mom-and-pop pharmacies. The savings can easily be up to 80%, but candidly, in most cases, they're 15 to 50%. We also have, if anybody happens to be taking a very expensive drug, Humira, like Humira or something like that, we do have an international mail order capability, so the precise same prescription, same manufacturer, same dose, if it comes out of Canada or the United Kingdom, literally can be 70 to 90% less than buying that same prescription in the United States. So the first program, Capstone Care Silver, which includes the unlimited telemedicine, the no-charge mental health counseling, and the discounts on prescription drugs, that's called Capstone Care Silver, and we're going to talk in a minute what it costs, but it is a fraction of traditional health insurance. So it's not $200 to $1,000 to $2,000 a month. It actually starts at $19.95 per month, and there have been special discounts that have been negotiated with your chamber. Our second program is similar. It also includes the unlimited telemedicine at no cost, 24/7, 365, etc. And by the way, just a quick anecdote. Let's say that one of your employees has a child that's got a low-grade fever or skin rash. Normally what has to happen, they need to see a doctor to get a prescription, but the problem is they can't see a doctor except during business hours, which means they have to go ahead and call off work, and then you lose their productivity and you have to scramble to fill their, their role for that particular day, etc. Whereas with our program, they could have talked to a physician at 6 in the morning, 7 at night, weekends, evenings, holidays, they're all covered. They don't have to miss work. And very importantly, if you or a member of your family comes down with something, you don't feel well, it's Saturday morning. Well, unless you want to go to an ER, which could cost you $1,000, or an urgent care, and even if you have an insurance policy, the unfortunate truth is that only a small fraction of people ever hit their deductible. So even when you have insurance, it's not paying for anything, which is one of the things that caused me to be so frustrated to want to form this particular company. So by comparison, someone could speak to a physician early Saturday morning or Sunday. They get care treated quicker. They'll start feeling better sooner, and it doesn't cost them anything. So it's a win-win for everybody. Now, our Capstone Care Premium program, again, includes everything, the unlimited telemedicine, the short-term mental health counseling, and the discounts on prescription drugs, but it also includes something that even very expensive health insurance traditionally virtually never covers, which is discounts on dental services. And this isn't just teeth cleaning. This is extractions, it's orthodontia, it's x-rays, everything. It's 10 to 50% off at 240,000 participating dentists nationwide. We also include 10 to 50% savings on vision care, chiropractic, hearing discounts, even some things that have nothing to do with human health care anyway, ID theft, pet meds, et cetera, et cetera. So it's a very, very comprehensive program. The cost of the program we'll get into in just a minute, and we've even negotiated something very special with the Chamber, where we're offering 1 month of health care at absolutely no charge. We'll explain how that works in just a second. So what are the benefits of offering Capstone Care? Well, again, the CDC says that telemedicine. Yes.
So I'm gonna do some listening.
I'm sorry, what, please?
You're fine. That was somebody in the background. I'll take care.
Okay, yeah, everybody should be on mute if you don't mind. In a few minutes, we'll start taking some questions. But the CDC does say that telemedicine can stop people from catching and spreading the coronavirus because they can get treated from the comfort and safety of their own home. And again, as we said earlier, this is really important because if one of your employees becomes sick with COVID-19 and brings it into your business, it could cause the business to be forced to shut down. We can also reduce the cost of providing health care by literally more than 90%. So let's assume you check out what's available and you find that the least expensive health insurance plan that's out there is, let's say, $300. Well, in our case, with the discount that's been provided through your chamber, our program starts at $17.95 per month per employee, so extremely affordable. And even if you're offering health care right now, you could go with a much less expensive version of health care strictly for catastrophic kinds of health issues, and then use Capstone Care for the day-to-day health concerns that people most commonly have, the top 75–80% of reasons most of us need to talk to doctors. And you'll find that if you have health insurance, because your employees will be using their traditional, more expensive health insurance a lot less often because they can get treated through Capstone Care, the odds would be that you would be in line to get a less high increase the following year. So even if you have insurance, you can use this as a supplement. It'll also help you hire better employees. Some anecdotal information says that if you're able to advertise that you offer a form of health care, you will get 2 to 5 times more applicants, which means that you could be more choosy as to who you hire. It will also help you reduce employee turnover because offering health care helps to anchor an employee to a position. Again, there'll be less employee sick days and call-offs, which makes life a lot easier for you in terms of scheduling your people. It will reduce your recruiting and training costs, which is obviously an important issue, and it will improve employee productivity, health, and job satisfaction. So, in terms of pricing, our Capstone Care entry-level program, Capstone Care Silver, is $19.95 per month. With the discount that's been arranged by Carlsbad, who are just a terrific chamber. We've been very pleased to be working with them. The price they've negotiated for you starts at $17.95 per month. Now, if you want, there is an option that we've put together where you can get 1 month free. Now, how that works is you would pay the regular price, which is $19.95, for month 1 and month 2, and then you get the 3rd month completely for free. And then if you should choose to continue after 3 months, the price will be reduced by 10%, so you will permanently be able to get your employees covered with our entry program for $17.95 per month. And very importantly, families are included for free. There's no extra cost for families. Now, a family is not considered to be, aunts, uncles, cousins, nieces, nephews, but it would be your employee, their spouse or their significant other, plus their dependent children up to the age of 26. So if you have an employee that has 5 children, they're all covered, plus the employee and their spouse, for as little as $17.95 per month. Our higher end program, the one that has the dental, works the same way. You pay the regular price, which is $25 for an individual, I'm rounding this up, or $30 for a family for month 1 and month 2. And then you will be able to get month 3 for free, and then and we can cover this, and then there's material I could send you. But starting in month 4, you'll get a permanent 10% discount. And if you happen to be with a very large company, we have volume discounts available. So let me give you an example in terms of what kind of savings we're talking about. Let's say that you have a 10-person company, and we're going to take a side-by-side comparison over a 3-month period of time. So let's say that the typical cost to provide insurance is $200 to $500 per employee. Well, over a 3-month period of time, when you work through the math, that would cost your company for 3 months for 10 people $6,000 to $15,000. $6,000 to $15,000 at $200 to $500 per employee for 3 months. By comparison, with this special program that's been put in place thanks to the Carlsbad Chamber, you would be able to cover 10 people for that 3-month trial period for $399. Now, that's not per employee. That's all 10 employees for 3 months for a grand total of $399. Our program has no contracts. It's month to month. We have to earn our stripes every month, so we need to prove to you that this is something that will be of very high value to your employees. So a couple other quick points, and then we're almost done. We'll open the floor to a few questions. What are the benefits? We talked a bit about the benefits to you as an employer, and there's quite a number of them. But how about the benefits for your employees? Well, Capstone Care will give them 24/7 access every day of the year to doctors from the comfort and safety of their home in under 1 hour. They can get medical care faster because they can get treated nights, weekends, holidays, it doesn't matter. So because they're getting treated faster, they'll get well sooner. It will eliminate doctor bills, copays, and deductibles, at least for the items that we cover. That'll save them a great deal of money. Even if they had insurance, they'd have to pay all those extra fees. It'll give them access to no-charge short-term mental health counseling. They'll be able to save money on all FDA-approved prescription drugs. If you go with our higher-end program, then we're talking, which the absolute maximum cost to you would be $26.95 per employee per month, including their family. That program, Capstone Care Premium, would give you 10 to 50% savings on dental services, which are typically not offered in even very, very expensive health insurance plans. They'll also get 10 to 50% discounts on chiropractic, hearing, vision, diabetes supplies, and a bunch more. Now, there are 3 ways that you can provide this to your employees. It can be fully employer paid by you. If you like the program but you can't afford to or don't want to pay for it, it can be fully employee paid. That's 0 cost to you. All we'd ask you to do is hand out information about the program. We can even do a teleseminar for your employees before work, after work, during the lunch hour, etc. So in that case, they're paying for it, but you've been able to get them, you can share the discount that's been negotiated with the Carlsbad Chamber. Or you can split the cost option. That would be completely all up to you. So this can be a standalone program, or it can be a supplement to existing health insurance to get rid of a lot of those copays and deductibles. And again, you can go with a much, much less expensive health insurance plan, pretty much strictly for the the catastrophic things that might happen to 5% of people and use our program for the day-to-day. Again, we have no contracts. It's month to month. There is next to no work to set up or administer this program. We'll do all the heavy lifting for you. You don't have to wait to January 1st to start. We can have you up and running in 3 to 7 days. And that's important.
Jeff, I'm going to interrupt you there. In the interest of time, we're at 10:27, and I wanted to see if there were any questions. I wanted to make sure there was a chance for them to ask, because as you know, we do have some other stuff coming up at 10:45. So if anybody had a question for Jeff, if you could unmute yourself and go ahead and ask the question. Jeff, could let's go ahead and we could stop the screen share for now, unless there's something that, well, I see you have your contact info up there. So please, everybody, if you want to grab that, or, I would also recommend, Jeff, you put it in the chat feature. But if you want to go ahead and go down to the screen share, let's see, I can probably do it. Oops, no, let me go up here. Any questions, though, while we have him on the line?
Yeah, Brett, thank you. I was about to end, and I'll just say to everybody real quickly, each company and each employer's case is completely unique, so please feel free to reach out. Would love to hear about your companies and explain how this could be customized specifically for the needs that you have versus today's more generic conversation.
Hey, Jeff, this is John O'Reilly. I had put a question in the chat early on. I think I know the answer. I put the question real early. This is not a traditional insurance plan, so HSA wouldn't apply to it, correct?
Yes, that's correct. This is designed to be an alternative for those that want to provide coverage but can't afford it or want to bring down the coverage that they have. And again, for some of us that joined, and forgive me for talking fast, I want to be respectful of the other presenters, we cover 75 to 80% of healthcare needs, but at 5 to 10% of the cost of health insurance. That's a good question, John, and I hope you and I have a chance to talk at your convenience next week. Any other quick questions? I know we got started a few minutes late, so we probably have no more than 4 or 5 minutes worth of questions, but I'll do my very best to answer them for you. We are going into the flu season and COVID, so it would be very helpful to your employees to have something in place before the healthcare situation gets even worse this fall.
Yeah, hi Jeff, this is Suhas.
Yes, Suhas, hello.
Thanks for this presentation, and the main reason I got on this, and I may actually disappoint you here. I'm just a one-man show, so I don't have any employees, but the reason what intrigued me in this, the email blast that came, is to reduce health insurance costs. And I do pay a lot of insurance one man for myself right now. And then so this may be something that we can talk offline, and I did note down your information here, so I'll send you an email or give you a call at some time. But what about, and this is sort of new to me too, so what about the visits and stuff, like, if I take this, and then maybe there is a way you can reduce my insurance, but what about, like, if I have to go get blood work done and all this stuff? I mean, I was not very clear on how that happens.
Yeah, and again, we should probably talk offline, and don't feel bad about being a one-man operation. We can work with one person. We're just as happy to do that. Again, as a social good company, we were formed to help people, and so we can really talk about that offline. But the issue is, if someone can't afford health insurance, they wouldn't have any coverage anyway. So this will cover everything else but the in-person or hospital kinds of stays, but again, at a fraction of the cost. And if you do have health insurance and it's expensive, again, we'll be able to bring down a lot of those deductibles and co-pays that you're experiencing, and doctor bills that are so frustrating right now. They'll go away with our program. So certainly we could talk a little bit offline, and I would love to talk to any of us who have called in. I know some people called in a little bit late. I have information that we could send to you, and would enjoy having a get acquainted discussion next week.
Jeff, I have another question that came into the chat from Jim, and it says, Does this satisfy the California mandate to have minimum essential coverage?
Unfortunately, again, we're an ethics-based company, so we always have to be completely forthright. It would not. I don't know precisely the California requirements, but because this is not health insurance and we don't cover things like hospital stays and cancer treatments, my guess is it probably would not. However, once again, if you can't afford $500 or $1,000 or $2,000 a month, this is something that's going to provide a tremendous amount of benefits. And if you do, then again, it'll make a lot of the costs that you're experiencing and a lot of those frustrations go away. So I wish I could say it would cover it. I don't think so. It's designed to be an alternative to expensive health insurance, especially for smaller employers, to bring down their cost or at least allow them to go with less expensive insurance. Brett, we're not hearing you right now.
Sorry about that. Thank you. I know we had it up on the screen, but if you could reiterate, I'm going to type into the chat your contact info, Jeff Roberts, and what's the phone number for you?
Yeah, I'll tell you what, I'll give you my direct dial. It is 440-729-0139, 440-729-0139, or you can send me an email to jroberts, R-O-B-E-R-T-S, jroberts@capstonehealthnetwork.com, and I can explain a little bit more in detail how you'd be able to get that one free month of health care that's been negotiated by Carlsbad Chamber of Commerce. And Brett, I want to thank you and your team. You've been wonderful to work with, just a real class act. And I want to thank everybody who has been listening in. It is my hope to have the opportunity and privilege to speak with you next week. Again, I'm quite concerned about what we're all hearing about flu season and COVID starting to take off again. And this could really help your employees, not to mention provide all the other benefits that we chatted about. So I greatly want to thank you for your time this morning. And Brett and Kathy and team, I want to thank you so much for setting all this up.
Well, thank you, Jeff. We appreciate it. Again, we're very excited about this program and what we can offer to our members through it and through you. So thank you so much. We are going to take a pause right now. So for those of you that are on the call right now at 10:45, so in 10 minutes, we are going to have a presentation about a new program called Passpoint, which is to help companies prevent, track, and trace COVID in the workplace to protect you liability-wise in case somebody does come down with it while you're there. So for the next 10 minutes, we're just going to transition. Our presenter is already on the call, so we're going to make sure he has what he needs to get his screen up. So feel free to just kind of zone out for a few minutes, and when we come back, and unless you're signing off, which of course is understandable, but feel free to check back with us in just a few minutes, and at 10:45, we'll start with our next presentation.